You have a C5, C6 disc herniation or disc bulge or degeneration in the cervical spine, and you're wondering what's a good way to sit down at the computer desk or to stand and carry your posture to not add extra stress on your neck. That's the focus of today's episode of Ask Dr. Walter Slubro. This is episode 28. What I do with each of these videos here in this special series on my channel is I take a comment or a question from the comment section of my videos, and I'll answer that question in a video format just like this. So by leaving a comment or a question below, then you may be featured next on one of my upcoming episodes in this special series of Ask Dr. Walter Slubro. So today's question is going to focus on the C5, C6 disc bulge, disc herniation area. This is a question asked by Mr. Sandu. Mr. Sandu has been an avid follower of my channel and very engaged with my channel, so I appreciate your questions and being engaged with my videos. And this is also, the answer is going to be great for anyone that has this situation anyways. So here's what Mr. Sandu asks. Good to see the C5, C6 topic. Few questions about this topic. 1. What would be right posture for desktop use? 2. What is the recommended head position while sitting and walking? 3. How does one come to feel that the bulge recovery is on track, especially while one doesn't have any numbness, tingling, radiating pain in the arms and hand? These are actually great questions and they all kind of relate together. So let's go one at a time. So what would be the right posture for desktop use or computer use, let's say, okay? So I talk a lot about how to sit properly on a chair and adding some pillows to make it more comfortable in my other videos. So you can check that out. It's gonna add now the computer component to this. So the best way to sit in the chair when using a desktop computer is in an upright position. Do not slouch. Do not slouch. You can affect your neck. You can affect your low back sacrum region. So by tilting the chair forward, so the chair should have a lever that allows you to tilt it forward, okay? So you're tilting the back of the chair forward and also the entire chair in the seat pan forward. If it doesn't have these levers, you should get a chair that has the levers that does that. So tilt the chair forward, or you can put a pillow behind your back to keep you in an upright position. So you want to be in an upright position. You want the head to be over shoulders. You don't want this. You don't want this. You want the head to be over the shoulders, okay? Now, here's the key, okay? With a desktop computer, you want the top of your eyes, okay? Top of your eyes to match the top of the monitor, okay? So imagine my finger here at the top of the video field there is the monitor. Then the monitor top would be at my eye level, okay? Can you picture that? Okay, so you want to bring your chair up or down or adjust the height of your monitor so the top part of the monitor is at eye level. So you can read the top of the monitor and a little bit down, and it's not too high and it's not too low, okay? So that's key. That's made a massive difference for me, and I recommend that tip to my patients. It makes a big difference as well, okay? You want to be sitting so your knees are at 90 degrees, your elbows are at 90 degrees, and you're not extending or flexing your wrist too much. They also want to be even, okay? Now, we talked about head position. So head position while sitting, ear over shoulder, okay? Same thing when you're walking. Try to keep your head upright. Keep your head upright, ear over shoulder, and avoid this while you're walking, okay? Same idea. So that covers 2. 3, how does one come to feel that this bulge in the neck is recovering, especially when there's no pain in the neck or no numbness and tingling? Great question. So if the symptoms have resolved, that already is one indication that the tissues have been healing and the inflammation has resolved. Because the only way to actually have pain is triggered by the chemical mediators from tissue damage, whether it's on the discs, ligaments, muscles, tendons, that those chemical mediators and the tissue injury, those signals reach the centers of your brain where you perceive pain, which is the limbic system, which is also associated with emotions and memory. So if you're not experiencing pain and someone's pressing those areas and it's not tender, then you know that the inflammation is resolved and the tissues have healed, okay? That's great. Same thing with the tingling. So if there's no tingling or numbing in the hands and fingers, then that means that the swelling on the nerves, the compression on the nerves is resolved, and that's indicating a portion of healing, okay? So, but I think the core of the question is how do you know if the actual disc has improved, if it's changed its shape, if it's been resorbed, if the integrity of the disc has been improved, the shape and so forth. So the only way to know that is by an MRI, okay? A post-treatment MRI or an MRI that's done after you feel better with your symptoms. The problem is that most doctors will not send you for an after MRI. They'll send you for a before treatment MRI or, a diagnostic MRI. And if you do a bunch of treatment or you start feeling better, they won't send you for a post-treatment MRI for a variety of different reasons. So So just because you're symptom-free or pain-free, you really don't know exactly if the disc bulge is completely resorbed, completely reshaped, or still there. The likelihood of it still being bulged is actually pretty high, because there can be disc bulges without any pain, irritation, or inflammation, okay? Now, on the other side of this conversation is that the better your spinal alignment and the alignment of the cervical spine, the neck, the better that alignment is, the less likely for tissue re-injury or disc re-injury. So that's where corrective chiropractic care comes into play, or chiropractic care also in general. So you want to look for a chiropractor that can take spinal x-rays and assess the alignment of your spine, not just from front to back, so this alignment, but you also want to check the alignment from the side, and you want to see if there's a natural curve in your neck. And if not, then you can do rehabilitative type, structural rehabilitative type work, where you're doing postural exercises and also traction exercises. I talk a lot about these in my other videos. You can look them up on C5, C6, and cervical kyphosis and straight cervical neck. So you can look those up, but you can do traction exercises to help restore and stabilize the cervical spine. And that can help keep the discs in better shape. What I mean by that is less abnormal loads that can trigger more injury, and also prevent them from getting worse down the road and cause, more inflammation and pain. Okay, so hope that covers your questions. And for everyone else, I hope that that clarifies some things for you as well. Right? So that's episode 28 of Ask Dr. Walter Salubro. Stay tuned for more and more videos as we keep uploading these videos, and I keep answering questions from my followers and my YouTube subscribers and fans. So if you have a comment, question, or thought, do leave it, because I always like to read those and reply to those. And who knows, maybe feature on the next episode of Ask Dr. Walter Salubro. And if you're new to my channel, do subscribe, because I have a ton of content coming up in the near future, and also on my video library that you can get lots of value when it comes to the cervical spine, thoracic spine, lumbar spine, rehabilitation, chiropractic care, and just getting back to normal life through a variety of different means by exercise and also chiropractic. Okay, so do subscribe to my channel, and if you missed any of the past episodes, do go right here, right there at the playlist, so you can catch some of the past episodes of the Ask Dr. Walter Salubro series.